I'm Elise Nielsen. I am working in labs biology engineering. And so I've had a lot of opportunities to work with amputees and have been able to see how much of a struggle it can be to get around daily activities based on the prosthetic. So I wanted to see how that translates into the workplace. So I found this interesting paper titled Job Satisfaction and Health Experience of People with Lower Limb Amputation in Comparison with Their Health Colleagues. So the objective of their study was to describe indicators of job dissatisfaction among amputee employees and compare job satisfaction and health experience with working amputee employees of that with their control subjects. So they start by introducing this inclusion-exclusion criteria. So they wanted unilateral lower limb amputees. They had to be 2 years post their amputation to kind of give them time to acclimate to their prosthetic, get back into the workforce. They had to be between 18 and 60 years old. This study came out of the Netherlands, so they wanted people to be working and living in the Netherlands and be able to fill out their Dutch questionnaire. So for their recruitment process, they contacted 49 orthopedic workshops in the Netherlands and asked if they had amputees that would be willing to participate in the study. And only 11 workshops met their criteria of actually having amputees that met their criteria and got back to them. So they had these workshops reach out to their patients and ask if they wanted to participate in the study. So 55% of them came back with a signed consent form saying, yeah, I'd like to be in the study. Then the researchers reached out to these patients with a questionnaire, and almost all of them, 95%, came back with filled out questionnaire. They excluded anybody who wasn't currently working, so they ended up with 413 amputee participants. They also wanted to have a control group, so they asked these amputee participants if they would recruit one of their coworkers who was a similar age, had similar tasks, so they could be a pretty good control. So for their methods, they gave these participants 2 questionnaires. The first one has these 2 sections. The first section just focuses on the characteristics of the amputation, what side it's on, if they're having pain, how often they use the prosthetic, and then any comorbidities that they have. So like if they have an amputation and diabetes or an amputation and depression, that sort of thing. The second section was characterizing their job, so what their job demands are, the work environment, the social environment, work-life balance, that sort of thing. Questionnaire 2 was just to assess the physical, social, and psychological well-being of the patients. So they used the RAND 36-item health survey that measures these 9 different dimensions. So physical functioning, social functioning, physical role restriction, emotional role restriction, mental health, vitality, pain, general health, and then health change. So starting with questionnaire 2, here are their results. They split it up between the amputee participants and the control subjects, and measuring those different dimensions. Then some of it is kind of counterintuitive, but the scores are, the higher the score is, the better your health is, the lower the score, the worse your health is. And they ran some statistics on this. They found a difference in the physical functioning, physical role restriction, and pain. So all the amputees scored worse in these subjects, in these categories, which is what you'd expect to see from this population. Then getting into the results from the first questionnaire, this first table, there's also a lot of tables, so I apologize, but it's what I got to work with. So this first table is mostly like demographic information, where the participants, what kind of category their participants work at, the level of amputation, if they have an amputation, education level, that sort of thing. And they didn't find any statistical significant differences in this chart, this table, but they did point out that their comparison between the amputee subjects with a control subject and the 413 amputees that didn't necessarily have a control subject were pretty similar. So they felt that it was a pretty good comparison for this smaller sample size to the larger population. They also show that the control subjects matched with the amputee subjects. These two, this like right side chart was showing that they thought that the matching between the controls and the amputees was pretty good. There was big demographic differences between them. Then they split up the amputee subjects into either they were satisfied with their job or they were not satisfied with their job, and had all these different categories that they measured. They ran stats and found statistical differences in these three. So if they had a comorbidity, if their mean mobility level, and then their wish for more modification in the workplace. Then they made a model to predict if you could predict if they were satisfied or not satisfied with their job. And they found that the comorbidity and the wish for more modification significant indicators of that relationship, not the mean mobility level, but those two. So then going on to comparing the amputees with their controls, this was just like their general satisfaction and contentment with the job. And after running stats, they found that the control subjects, the healthy subjects, were more likely to be less satisfied with their job, which I thought was really interesting and surprising. However, I also didn't read the introduction the first time I read the paper, and going back and reading the introduction, it says that this is kind of well known that if you have a chronic disease, you're more likely to be satisfied with your job than your healthy coworkers, which I thought was very interesting. So then kind of reframing the point of this paper is to figure out why the amputees have, why there is a difference between the amputee and controls satisfaction ratings. So this section's looking at physical and mental exertion. There's no statistically significant differences between the two groups. However, the amputee participants had higher scores for thinking that the work was physically and mentally demanding, whereas the controls had a higher score for saying they were often tired at work. So I thought that was an interesting kind of discrepancy. The next section is about management and colleagues. Again, no statistically significant differences here, but it does have higher scores for the controls, thinking that their supervisor has a negative view of them, or they don't get enough credit or take their into account, which later or part of the paper talks about how supervisors or employers have a more negative view of of individuals with a chronic disease compared to their healthy counterparts. So I thought it was interesting that the controls actually felt they were more negatively viewed than the amputees. Then this section was on work-life balance. Again, no statistically significant differences here, but the controls thought that they had insufficient pay or bad job prospects for their job compared to the amputees, which again in the paper, it talks about how amputees are more likely to be fired or let go from their job than their healthy counterparts. So I thought it was interesting. Oh, and also they are less likely to get a promotion. So I thought it was interesting the controls felt like they were inhibited in their job progression. Then we do get some differences here with the controls felt that they were often hindered by others' failures. So I guess they just are a little bit more impatient with others when they make mistakes. So I thought this was interesting. Looking at the physical working conditions and safety, another difference is, again, the controls had a higher score saying that they felt hindered by the temperature fluctuations, which again surprises me because amputees, the socket that they would have for their prosthetic can be very sensitive to fluctuations, especially temperature. If you get really hot and sweaty, there's less, you don't have as good of a fit in your socket, and then you have to take it off and maybe dump out the sweat, put it back on, and that can be really inconvenient during a work day, I'd imagine. But again, the controls had more complaints than the amputees. But their main takeaways from this whole study was that there was a relationship between the job satisfaction and two factors: the wish to improve the workplace for limitations presented by the amputation, and the presence of comorbidity. So I asked ChatGPT to give me the strengths and weaknesses of this paper. The strengths that it mentioned was that it had a well-matched control group, that their sample size was pretty good, that it focuses on working individuals, removes confounding factors from early amputation by the wait for like the 2+ years after their amputation, and the use of the RAND, which is a validated quality of life tool. Then for the weaknesses, they have this list. So the cross-sectional study, which cannot determine causality, self-reported measures, which can kind of introduce some bias. And a lot of the questions were just like yes or no, so I think that could kind of be limiting. The survivor bias, healthy worker effect, which I thought this was an interesting point. It basically saying if they're only taking the amputees that are currently working, then they've ruled out everybody who maybe had grievances or issues with their work condition and just left and quit or whatever it ended up being. So they're kind of getting a limited view of only getting people who are still okay with working at their job. Then it says limited generalizability, I guess because it's just in the Netherlands, and it was only because, and they only recruited people who were associated with these orthopedic workshops. Then these last two, no task level analysis and limited comorbidity details, I really agree with. The two things that they came out with saying that was really important indicators was presence of comorbidity and wish for better improvements in their workplace. And I wish they had asked for more details on what improvements they would have liked, because there's no task level analysis. There's no figuring out like, are you having issues just like in a desk day job, or are you having issues walking around doing heavy labor, that sort of thing. So I thought that was a little weak. And then the comorbidity as well. I wish instead of them just asking if there was a presence of it, if they asked specifics, like if it was, they had diabetes or arthritis, maybe arthritis, you're more inhibited physically, if you've got more pain, that sort of thing. So I think that's all the thoughts I had on this paper. I'd like hearing yours. Okay.
What metrics did they use to match the controls?
I think they just asked the amputees if they would find somebody at their workplace who would be interested in doing it, who was the same age, and I think similar work tasks. And I want to say they asked about health as well, just like generally if they seem about the same.
In your personal interactions with amputees over your time at the lab, do you have any intuition for why amputees seem to have a more positive outlook on their job?
I guess part of the paper too talks about how there's this idea of like they're more grateful for what they've got when they had a limited and they kind of realize what they have after an amputation or any other chronic issue they've had. So I thought that was interesting. I feel like they don't really talk about it that much. I've also taken a psychology class that kind of talks about comparing, you would answer differently if you were asked what you think something is versus what it would be compared to somebody else, I guess, if that makes sense. If you were to ask someone like, are you an extrovert, and they've got a lot of extroverted friends, they may say not really. But if you ask someone if they're an extrovert and they've got a lot of introverted friends, and say yeah, for sure. So I was wondering if that kind of played into it, where they're like, well, yeah, I feel like I'm fine at what I do compared to what I think I should be doing, sort of thing. I don't know.
As a point of interest, I found it really interesting, the difference between others are responsible for my problems at work versus not me, which is related to a psychological construct of locus of control. And that external locus of control is associated with a lot of not great things, including risk for safety incidents. So it's just I don't know what else to say other than it's really interesting to me that that difference was significant and that the amputees had a higher internal locus of control, roughly, based on the question.
Yeah, I thought so too, because I think, I can't remember what they said, they list kind of what what the reasons for the amputation was, and a lot of them, I think it's like 60-ish% was related to trauma, which I think would be interesting. Yeah, I would expect that to be more of an external factor than like some internal, like a diabetes thing where you need to manage intake or something. I don't know.
And on that note, I just looked it up. In the US, 80% of lower leg amputations are diabetes related. But in this sample, there was 0, I think, or very few.
Yeah, there was, I guess, just one out of that 413. Yeah. Which I also think kind of what ChatGPT suggests, this limited generalizability. It might have been like a good representation of their bigger sample, but out of all amputees, it's not representative. The one thing I did think was interesting is the split between men and women was like 80-20-ish, 75-25, which I thought was weird, but then I looked it up and it also that's what it is worldwide, is it's more men have an amputation than women.
I think it's likely that you referred to, Dr. Olson, that most of the diabetic patients with amputation have.
Yeah.
Oh, I didn't
So
know.
that inclusion criteria
Yeah,
excluded them.
so it is kind of an interesting population, I think. But I think I did about 25 amputation. They were not helpful.
It could also be that the country that the study is based in is a Nordic country where people tend to be healthier, and the diabetes is lower prevalence there.
Maybe for them.
So sample representative came up, and my methods class is talking about sampling strategies today.
What do you call that?
So, with that,
I wonder.
they're sampling method. Well, I'm curious.
It's like a snowball.
It was a very interesting way to get a matched sample. Any comments on the sampling strategy, strengths or limitations?
I was gonna say in terms of the matching, it could introduce a small amount of bias because maybe, they're probably friends with this individual. And they may answer things the same way. They may see things in the same light and kind of answer the questionnaires in the same way, just with matched personalities and interests.
Yeah, in part, it's a strength that they're from a similar workplace, but within a workplace and within a work group, people will be more similar than different. But their goal is to try and match, so it's kind of an interesting method.
I think it's kind of smart. I mean, if this were a very well-established area of research, it would probably be wise to have slightly better controls over it. But for the purpose of their study, it seems like it was a great way to in the form of matching to try and have some comparison. It would be interesting to see how the results would change if it was a more controlled matching opposed to just getting your friend. And because, I mean, in theory, they could have all picked friends that they know have certain dispositions towards work, or even people that are willing to participate in a study or in a survey might have a different disposition towards their work. So
Would have been cool if they had a third group. It's like a generalized worker group.
So before we leave sample, what about the sampling frame? It was clusters was their sampling frame. How did they do? You can look in the paper. They identified almost every single orthopedic workshop in the whole country. So a pretty strong cluster sampling frame. And then they describe how many eventually agreed to participate, but they did start with almost every possible orthopedic workshop in the country, which was pretty strong, but only about half of them ended up participating.
Question for the IO psychology class. Why isn't this sample 93% satisfied with their job? How come they have they actually were able to compare to people who liked and didn't like their jobs? Like, going on there? Was that Jordan? The facets, okay, maybe,
We're honest.
maybe, right?
Confidential survey.
Confidential survey, maybe they were honest instead of with Gallup, people weren't honest with that. What's different about this sample than you think that gigantic Gallup sample?
Oh, I mean, these are workers. I guess Gallup,
Yeah, Gallup
they
would
were
work
working
too.
too, yeah. Right.
A good portion of them are amputees.
Yeah.
Right?
Yeah.
That's a pretty unique characteristic that maybe this distribution and satisfaction is appropriate for that, but it is very different than a regular worker population. Even within, the Netherlands, which is where this came from, so.
I don't remember, was one of the points, that the amputee group were employed, was that part of the results or no?
Wait, sorry.
Like, we're in jobs that weren't, suited for them, or, was there any mention of that or no?
There was. There could have been, I just missed it, but I don't.
I didn't remember.
I have one more question. So also in IOP, we're talking about types of commitment employees have to their organization. And one of those types is normative commitment, which is, is staying with my organization. Is it the right thing to do? Like, is that because of what they've given me, is it right to stay at this organization like loyalty?
Mhm.
How much of the results in terms of the amputees do you think could be inflated because they feel loyal to their organization because they looked past their condition and they feel, this need or obligation to do good and just to be satisfied with their job or to just say that they're satisfied with their job?
Interesting. I don't know. They don't really talk that much. Yeah, I wish there was a little bit more like psychology behind some of these answers, or at least not just like yes or no's. I wish there was a little bit more dimensional. But part of what it talks about is just that employers have a more negative view towards people with a chronic disease. So I would kind of be surprised if this population felt that they were very valued, felt a need to be loyal to a company, but they also don't take any data on the supervisors or workers' perception of them either. So it's not like you can kind of compare and see if their perception is skewed or not.
Gotcha. For sure.
I wonder too if with the cultural aspect, I'm sure in a Western culture, we might judge individuals because they have amputations based on the potential that it came from diabetes or something that our culture views as more of a characteristic or something that the person could control, where in a more Nordic or the other type of sample, they might view individuals culturally as that happened to them. It's not who they are as a person. And then also this paper was from 2003, and it would be interesting to see how more progressive opinions of individuals that have had amputations would change it now. Because they might, like Zach was kind of saying, they might feel the need to have satisfaction in their job because of all of the forces that are against them. But it would be interesting for maybe like a follow-up or something now with a potentially more progressive culture to talk about this issue again, I guess.
That's fair. I didn't check to see where some of these references were, where they cite that people would have a negative view towards them. I don't know if it's like also in the Netherlands or if it is more of a Western thing. So, yeah.
Okay, anything else? Okay, thank you very much. Before we go to Jesse, Dr. Olson has a quick announcement.
Okay, so to not disrupt the slides, I'm not gonna post the QR code, but I'm gonna print a flyer with the QR code. The Division of Occupational Environmental Health is sponsoring a Healthy Habits Challenge from March 9th to the end of the semester, basically. And to participate, you just have to pick a healthy habit to work on for 6 weeks, do a survey once a week, reporting on how many days you did your goal habit. And there will be prizes administered each week for people doing what they are working on, participation based, not behavior level based. And at the end, we'll have like a grand prize drawing from everybody who did at least 70% of all the challenge activities. So Ashley Beeler, Kate Hatcher organized this. We'd love lots of people to participate, faculty, staff, students. I'm gonna do veggies. That's gonna be my 5 servings of fruits and veggies a day is gonna be my habit. So, but you gotta sign up between now and next Friday, hopefully before Monday. Technically, everybody's supposed to start working on this Monday, but spread the word. I'm gonna print the flyer now and stick it up on the back wall so you can, and it's like a simple form to join. It'll take like 1 minute. Any questions before you get back to the Journal Club? Yes. I think it's mostly like cash gift cards. Gift cards, not cash.
Giant candy bars.
There may be some fun things like workout or exercise related stuff. Oh, the behavior categories are sleep, eating, exercise, and stress management. So for students, right, stress management, you're doing that anyway. So go ahead and be doing.
Is there a health insurance benefit with it too?
Only for staff and faculty.
Oh, no.
Staff and faculty get discounts toward healthcare discount.
Uttering.
Then you're unhealthy anyway, so.
Hi, everyone. I'm Jesse. I'm also a PhD student in the bionic engineering lab. Like fun fact about me, which I don't think will surprise anyone. I really like robots. I do a lot of design work in lab, and I find that those papers tend to be really dense and math heavy. So I was kind of hunting around for a different sort of paper, and then I was thinking about whether or not you have these situations where people implement robots in like workplaces and it actually gets more dangerous. And I was trying to find some paper about that, and instead I found this, which I was really hoping was going to be like Terminator-esque, you know, robots kind of killing people. I don't know, but it ended up being kind of interesting, so I figured I'd present on it again. Anywho, I'm going to present on Death by Robots, which is about automation and working age mortality in the United States. Just some background information for this presentation. I wasn't super familiar with this, like I kind of knew about it, but I didn't really know the exact statistics. So around the 1980s, the life expectancy of people in the United States started to diverge from other comparable countries, like in Europe, Australia, and Canada. And around modern times, this ends at 2023. I believe we have 4 years less life than comparable countries, which obviously is not what you want to hear. You kind of want to see people, you know, living as long as other comparable countries. And then more background, just like some difference between manual labor and automation. So like primarily in the 1980s, you have these really large employers like General Motors, General Electric, the car companies, which are primarily relying on manual labor. So you have people making parts, you have people putting together cars, and you have a lot of, you know, workers, people doing things on like an assembly line. Around the 1980s, you start seeing the advent of robots replacing some of these jobs. You have robots putting together cars, you have computer-aided design, you have CNCs making parts. And obviously one of the consequences of that, I guess, is that you have less people working on assembly lines or putting things together. And then the last piece of background. So at the beginning of this paper, sorry, not the beginning of the paper, the beginning of the study period of this paper is 1993. You can see in the United States, manufacturing makes up the primary employment in the majority of states. You also have retail, which is Walmart, pretty much in the rest of the states, and then a couple of outliers. You have healthcare in some states and some other stuff. You have food services in Nevada, which is Las Vegas. 2007, you see this really big shift away from manufacturing jobs towards retail. So employers like Walmart grew quite a bit during this time, that sort of industry, and you see decreases in jobs at like General Motors, General Electric, and other manufacturing jobs. Just out of curiosity, I kind of looked at where it's at today, where I got this data from, which I think is the US Bureau of Labor and Statistics, I think. It's starting to shift towards like social work now. Not really important, but I thought it was kind of interesting, but still a very big shift away from manufacturing. So the main goal of this paper was really just to see if, as you have this increase in automation and people working less in manufacturing, you have people losing their jobs, you have people earning less money, and they want to see if there's any comparable analysis between this and the rise or the decrease in life expectancy in the United States. You do this, oh, I do have to over paper overview, sorry. To do this, they kind of take this big data set from 1993 to 2007, and they measured the increase in robots or automation devices per 1,000 workers. This is measured in like a really weird way. It's measured in commuting zones, which they got from another paper. And they compare this to mortality rates that they get from death certificate data. Let's see. And they're also very interested in like deaths of despair. So they're interested in people who are dying from drug overdoses and suicides, alcohol-related liver disease, which I thought was kind of interesting, but I didn't really see how they were drawing those lines. We'll kind of get to that later. They were also kind of interested in these causal pathways in contextual moderators. So they came up with two causal pathways, like a material pathway. And what that is like you lose your job to an automation robot and you have less money, you don't have as much social standing, you have decreased wages and decreased local economic demand. So obviously other businesses kind of suffer when you have a decrease in job market in like a specific area. They also have this despair pathway where you have this effect that they cited from other papers where if you think you have like less economic options in your area, then you also have like perceived decreases in like you are less happy and that kind of leads to other health effects. For contextual moderators, they considered things like social safety net policies, so Medicare, unemployment insurance, labor market policies, so minimum wage by state, by county, that sort of thing, and right to work laws. I didn't know what right to work laws were, but from what I understand from briefly looking up, right to work laws are actually about whether or not it's required for you to join a union in certain states. Someone could correct me if I'm wrong, but I think that's what it is. And they also looked into local supply of prescription opioids, which I thought was kind of an interesting take on all of this. Cool. So the automation data, what they're looking for, and I think I said this before, is increase in industrial robots per 1,000 workers. These segregations on the map are commuting zones. They got this from another paper, and I couldn't quite figure out how they figured this out. Some of these seem like very county related, and then some of them are absolutely massive commuting zones, like on the West Coast around like Nevada. So I thought it was kind of interesting. They didn't really do a good job of explaining what that really means. And it's also defined by 1970s data, which I think is a little bit outdated for a study that's considering data from 1993 to 2007. They also collected data from 5 comparable European countries, which Denmark, Finland, France, Italy, and Sweden. I never quite caught what they used this data for, but they were citing a bunch of work from a previous paper. I'm guessing as someone that worked in their same research group. And that was something that they mentioned, and then I never heard about it. So, something else to keep in mind. For mortality, they collected data from death certificate information, the National Center for Health Statistics, and they split that data by county, sex, and age. Age was split into the following groups. It was 20 to 29, 30 to 44, 45 to 54, and 55 to 64. I thought it was kind of interesting that one of those age groups is 15 years and the rest are 10. I didn't really see a good explanation for that either, but I feel like that might be based on previous literature. And then they had mortality rates calculated based on each of these groups for a variety of different causes. To analyze this, they used a first differences model, and this is like the only slide of math in here. And honestly, I don't exactly understand what's going on in here. Delta Y is the change in mortality from 1993 to 2007. Alpha is like their variable of interest that captures like the change relative to the number of automation robots. Delta automation is the change in automation robots per 1,000 workers. And then you have this baseline characteristic that's used to adjust for correlating characteristics. I did not quite get what that was either, but I was hoping someone had a better idea what sort of statistical analysis this was. And then theta R, which is a vector of fixed effects for the 9 census divisions of the United States.
It might be a little bit of a linear mixed effects model.
Yeah, I think that's what it was. I was like really trying to figure it out. And then there's also 2 more variables in here that they never explain what they are. So there's beta and E. I couldn't find that anywhere in the paper. And then I asked Claude what it was and not a clue. So that kind of hurts me.
Sorry, interaction model.
But yeah, I thought that was kind of interesting that they had this whole thing that they were using and they never quite explained all of it. Which in my mind is a big no-no for a paper. Yeah. Oh yeah, so those are the 2 variables that are undefined. Okay, cool. So based on this data and their model, they have results split between female and male, and then between all 4 age groups. On the top, they have the overall increase in deaths per 1 robot per 1,000 workers. Sorry, it's kind of confusing. This is also a little bit small. The female one on there too. They found statistical differences for the male group for ages 45 to 54. What they saw was about an increase of 8 deaths per 100,000 people for every 1 automation robot per 1,000 workers. They also found what they said was like statistical differences in drug overdose for all 4 groups. They changed their p-value a bunch of times. So for their statistical significance, they were using a p-value of 0.05. And then for some of those, it was 0.1. And also it seems like the error bar is crossing that 0 line, which if I remember right, kind of makes that not so statistically significant, but they were really trying to claim that it was. For the female group, they saw similar results, but with less effect. So same age group, 45 to 54. See this increase in overall mortality for increase in robots. And then a lot of the effects when you split by mortality are a lot less pronounced for the females when compared to the males. They also compared these values for their like moderators. So these are social safety net policies and work policies. So you have a generosity index, which is a mix of Medicaid and unemployment insurance. And what they see for that is if you have a low generosity index, you see a bigger effect of this increase in automation. And that tends to be statistically significant for a variety of things. The unemployment insurance was what was definitely very statistically significant. And then on the other side, right to work laws. So if you don't require people to join unions, you have a much higher effect of this. So higher mortality for an increase in automation. And same deal with state minimum wage. If it's low, you see worse results. And if your minimum wage is high, you see better results, less deaths. And then opioid results. I didn't quite understand what this meant. But I think they saw like for drug overdoses, you see a little bit of an increase when the local supply of opioids is higher. So yeah, I don't know. Overall, very interesting paper, but it's confusing to me, a little bit out of my wheelhouse, and hopefully good for discussion. Yeah. As far as strengths and weaknesses, I thought it was kind of interesting that they had this large observational data set. the way they phrased the paper, it made me think that they had data continuously from 1993 to 2007. And then when I was looking at the analysis, it seemed like they took data from 1983 and data from 2007 and just compared the two. So you have this increase from baseline or decrease from baseline. I would have preferred, especially since they wanted to do these causal pathways, if they took more data like every year or something and saw like trends, not just like a line between 2 points. I thought it was kind of a novel insight. It's interesting to think about implementing these sorts of engineering controls, I guess is what it would be. So traditionally manual labor is a little bit dangerous. I don't know if any of you have ever worked with like a lathe, but spinning a big block of wood or metal tends to be a little dangerous. Like hair gets caught in it, or you didn't put it in there right, it's just gonna go flying. Kind of fun, but very scary. I thought it was interesting that they talked about how like adding controls to this might have unintended effects. So you might prevent workers from getting injured while they're doing this work, but if they end up losing their job because of this intervention, that might have large unintended effects. I thought it was kind of interesting to think about like long-term effects of economic changes. Weaknesses, I didn't really agree with their drawing of causal links from like non-experimental data. Obviously I didn't understand the analysis super well, so maybe I'm wrong in that, but I don't think you can necessarily draw that kind of link from this data. The measure of automation didn't really capture some things like job pathways. So on one hand, you might not be working doing manual labor anymore, but maybe you shift and you start maintaining the robots instead. So there are pathways where you change jobs instead of lose them. And I don't think they really took that into consideration of this paper. They only addressed 3 possible modifiers. So it was like the social safety net programs, opioids, and state laws like minimum wage and right to work laws. I think this is obviously a much more complex issue. Is an entire country. There's a lot of things going on. So obviously a lot more going on and maybe warrants for future research. Yeah, and also mortality was already worsening by 1993. So that plot I showed you at the beginning, the trend away from like comparable countries starts around 1980, and then this is 13 years after that. So it's kind of hard to say how much is caused by automation, if at all, and what's caused by other things. Yeah, then I have a couple of discussion questions I came up with. Obviously, if this is true and automation kind of causes these issues, should we just scale back on automation? Should send people back to working manually? I also thought it was kind of an interesting mirror to artificial intelligence right now. So we're obviously investing heavily in the United States in artificial intelligence. And some of the goals of that, at least if you listen to like the news, is to replace some jobs that are traditionally held by working class people. If this paper is correct, then I think you could see a similar trend where you see worsening quality of life when people have their jobs replaced by AI, if they have their jobs replaced by AI. Obviously, you kind of still up in there. And also, do you think the authors can draw these causal conclusions from the data used? That's and any thoughts, questions?
My impression was that the author started this whole project with the intent of writing about how robots taking people's jobs is causing mortalities. Like it feels
like they had a conclusion before the study. Yeah, I get that a little bit. In the title of the paper alone, I think they think that they're going for like attention grabbing and they want people to read it. That's why I read it. I was really hunting for funny papers about robots online. So yeah, I think obviously there's some risk of there being bias in this. If you read the paper too, they cite previous work by like Akimoglu and Restrepo, I think 20 times. My understanding is that pretty much all of this data is from that paper. So what I also kind of guess is maybe this is people who work in the same lab and they have access to the data set or they know these people and they want to use it just to write it on a paper. Maybe not the most academically merited study, but interesting.
Not like super relevant, and other stats people could chime in. I'm pretty sure the E in the equation is just the error, so they're just accounting for error in the equation. It wouldn't have hurted to mention that, but I'm assuming that's what that is. In terms of their beta for their slope, yeah, I'm still kind of at a blank there. I'd probably need to read more, but I think that's where the E's from, is just error.
Sound like you'd know better than I.
Does anybody know where Utah falls in some of these state policies that were predictive of suicide risk? Minimum wage laws, right to work.
I know that Utah has very low minimum wage, still $7.25, it's the national minimum
Yep,
wage.
our state has what are called preemption laws, which means Salt Lake City cannot establish a minimum wage that's higher than is set at the state level. And we also are a right to work state, which basically discourages unionization and organizing. We'd need a public health scholar to talk to us about our generosity index, but each state will have one. So if we were more of a manufacturing state, some of these big suicide odds ratios would apply to Utah. So those are what's pretty cool is we talk about policies all the time, you know, protective policies, practices. Those state level policies are having pretty big odds ratio effects with worker mortality risk. And those are changeable things and at the state level.
You know, interestingly enough, they like to use a lot of causal language. And yes, 1993 is before 2007, but there's a whole lot of things going on in there. And so, the fact that they found anything is actually kind of remarkable because there's so much going on in that process of, you know, of mortality and work and so forth. But that being said, I would be, regardless of the, you know, of the time order they've got there, I would be hesitant to pick just automation as the driving factor.
Yeah, I see it as
You
like,
could also throw in things like, you know, availability of cheap, you know,
yeah, this is
fattening
obviously,
food.
cheap fattening
High
food.
processed, you know, foods and services, and, you know, there's a lot of other factors that happen during that, you know, period that are contributing to mortality.
It's not even that, like global economics has a lot to do with this
Yeah.
too. The fact that we have less automation, or sorry, less like manual labor jobs also has a lot to do with cheaper labor outside the United
Yeah.
States driving some of this, so. I can speak personally to some of this. In our lab, we do a lot of design work, and just from like economic reasons, we actually get all of our parts manufactured in China. It ends up being like an order of magnitude cheaper for us to get parts there. And it's just really hard to compete with certain things like that. Obviously, you can't really compete in the United States with those kinds of price differences.
Well, it's kind of funny that, you know, in 1993, you didn't go to the gym unless you were playing sports.
Yeah.
Right, and pretty much every gym that's out there that you can bid a membership of and that nobody actually goes to, didn't exist in 1993. You know, yes, there were community rec centers to some degree, but those are where your kids went to play, you know, in the pool in the summer and stuff like that. So it's just interesting that time frame, there's a lot of, you know, a lot of things change over that time frame, including automation.
Yeah.
So we don't take away from that, but they're small odds ratios they found too, so.
Yeah.
Anyway. Things to think about.
In the paper, it says that new automation leads to job losses, which makes sense. But what doesn't make sense to me is that the paper talks as if those people no longer had a job. Like, wouldn't they just go get a new job?
I think they try to address this in the sense that they talk about like state laws, so unemployment insurance and minimum wage. So they also mentioned briefly at the beginning of the paper, manual labor tends to, or it used to be, a very big pathway for non-college educated people to reach the middle class. This was like a common pathway kind of thing. And so if you lose this manufacturing job and you also don't have another college degree, then you might fall back on minimum wage jobs, right? So I'm gonna guess that back then, even with the minimum wage, these manufacturing jobs are paying more. And if you lose your minimum wage, or sorry, your manufacturing job, you have no other applicable skills, you might have to fall back on a lower paying job for a while. You like take a decrease in pay, in theory. That was kind of how they tried to address that. But obviously, that's not necessarily true. You can opt in transfer this kind of knowledge into a different field that pays similar. It's not like that, and that experience is unvaluable.
Kind of the point that you talked about earlier, where you could pivot and go down a different career path. There's 500 plant workers and they all get laid off, and there's 10 positions to work on the machines, right? That's like 490 people that are having to go back. And then so that's a hard thing too, is there are different pathways, but with machines, there's normally less jobs after than before. So there's always going to be scarcity.
Yeah, and complex issue, right? Like, there's a chance that like the people who design the machines, so engineers in theory might be taking these jobs where you're maintaining these machines, and then that's like 0 jobs out of 500. Or maybe you need one worker for every 2 machines. It's hard to tell how that really works out.
Could you talk more about the commuting zones? It's like, how are those established, and then also how much would you expect those to change from the 70s to the 90s to 2000s?
So as far as how they were established, I could not quite get that out of this paper. I think that's another thing that they got from the previous work they keep citing, but
Okay.
I can take a quick look. So my understanding is that like when you have these big employers, you see people traveling from outside like their local neighborhood or community to go work there. And we see some of that in like Utah too. So the people in occupational health, we saw that some of the firefighters are commuting from like St. George to Salt Lake City. So my guess is the previous paper got some form of like employment data where you just have address and where they worked. And you can kind of take this map and see where people are on average commuting from to work. And then you just take like big areas of like this kind of general area, and this employer or group of employers has like a commuting zone.
Yeah.
But yeah, obviously like 1970 to 1993, that's 20 years. Businesses change, get more plants or less plants, people go out of business, new companies. So I think using that kind of data to draw these like areas is kind of out. Obviously adds like a little bit of error to this analysis.
Okay. Sounds good. I believe we'll be in the auditorium next week.
I think next week is spring break. So in 2 weeks,
2
we
weeks.
hope to be in the auditorium.
Perfect.